various centers in the United States, particularly Duke and Memorial, following the lead of centers in Barcelona and in Sweden, the Karolinska Institute, decided to see if it was possible and feasible to do homebound transplant. This means that the patients get the chemotherapy as an outpatient, they get their cells in the outpatient, but most of the outpatient care is delivered at home, either through telemedicine strategies or for mobile nursing. This is particularly important because there's this big movement now in the United States of creating hospitals at home. And we think, and the patients will tell you, there's nothing for them more disruptive than to having to be admitted to the hospital. Universally, patients prefer outpatient transplants, but even for many patients, outpatient transplant is very disruptive. They have to go to a hotel-like environment. And it's really, they're far away from things that make them feel comfortable. And although it's a better healing environment, it's still not the healing environment that you find from home. Not everybody qualifies. The home environment has to be safe. They have to have caregivers. They have to have good Wi-Fi, good connections, and the home has to be within a certain distance from the hospital. Then in case of an emergency, an ambulance service can bring the patients in. We have finished the pilot trial, and now we're on a second phase. And I think this will be a unique way of delivering cell therapies to patients.